Hello everyone, I'm Deepa here again. I came with some grammar session today as I promised before. I got many questions about the grammar, how to use in the OET. And as you all know, grammar is very big topic. So I cannot cover all that, and I am a staff nurse. I have limited knowledge in English grammar. And while watching this video, if you find anything related to OET, related to grammar that I'm telling in a wrong way, please comment and you can tell the correct answer so that it will be helpful for everyone. And as per the request, I'm going through the first one, how to use has been in an OET letter. So has been is, I think many are asking me the same question, that what's the difference between was admitted uh, and or has and has been taking this medication, has been this and this. I'm getting many queries related to that, and how can we correct it. That's we're gonna discuss. First one, I am just telling in brief that how can you write a sentence with has been. That's what we need as a OET student, but that's what we need. So in the letter, if you write, for example, one person has diabetes, and you want to write a past medical history that he had diabetes in the past. Now what you are going to do is, you still the patient has the diabetes, and in future also he may have this diabetes. This is not something which is cured. This is not something which is completed in the past. It was started, it was diagnosed in the past, but still the patient has that disease, and it will be continuing to future too. In that case, you are using has been. So if you want to use she or Mr. X or Mrs. X, Mr. X has been, don't use diabetes. You have to use diabetic, because has been diabetic since 2000. That's a correct way of writing. What you can do is, to understand this, make a note. Like if you get a diagnosis, like if you are going through a letter, in that letter it's given December 2007, diagnosed as CA lung, or cancer of lung. You found that. So make sure this time today also patient has the same condition. So in future you are referring to an oncologist for more further care or something, more suggestion, something like that. In that case, you can make the sentence like, Mr. X has been what? CA lung is the condition. So how you will write that? In diabetes case, you wrote has been diabetic. So has been cancer lung. Can you write like that? No, you cannot. So you make the sentence how you can use it in your OET letter. See, now you have another option. You can use the other style, that has had. You know, had is past. Something happened in the past, you are using had. If you add has along with that had, that means it was happened in the past and still it is continuing. The same, almost similar meaning of has been. So what you can write, Mr. X has had CA lung since what time period? 2000, whatever. The word has been or has had, whatever you use along with the disease, you have to mention a time period. Like if you use an year or a particular date, you have to mention since 2000 or since December so and so, whatever. But if you are mentioning like a duration, 5 years, 6 years, make sure you use for, FOR, instead of since. That's the difference between has been and has had. So now what you can do, take a question paper from any OET question paper and take one past history from that. Try to write, Mr. John has had hypertension since 2000, or Mr. Peter has been diabetic since 2000. Or this way, make some sentences, then it will be fine for you. The another question about this has been was problem with the when you write diagnosed. He was diagnosed, has been diagnosed. What's the difference in between? Was diagnosed, if you want to use, you have to use like a what to say, short-term diseases. One disease which was happened and it was cured in our hospital. For example, a lung infection or pneumonia. Patient had pneumonia and we diagnosed that pneumonia. We give an antibiotic in the hospital stay and now is all right. At the time of discharge, patient is all right. There is no symptoms of pneumonia. In that case, you can write that Mr. X was diagnosed as pneumonitis or whatever, appendicitis or whatever you can write. But if you want to write has been, that means after discharge also patient has the same symptoms, like long-term disease has been diagnosed as cancer, you can say, for example. That's the difference in diagnosis, was diagnosed and has been diagnosed. For that also, make a sentence and confirm that. Whenever you want, just pause this video and write by your own, then continue. Don't watch the video for a watching purpose, but you have to understand what I say. So what you can do is write down the sentence which is was diagnosed and has been diagnosed. If the patient has two diseases, one short term and one long term, write both sentences. Okay. The next question was about the following and followed by. Many people are asking this question. Until now, I know many of them are not clear about that. What trick here we can use is that followed by is happening almost every time in the hospital setting, not from the home, whereas following is happening at home. For example, a patient had a fall and he came here and we done a surgery for him. The fall happened where? Not in the hospital. But if you write followed by there, that means this fall happened in the hospital. If you write followed by, that means this fall happened in the hospital. So if you write following, that means patient had a surgery following a fall at home, following at home, followed by in the hospital. So when we should use this followed by, a patient had a left lung lobectomy, and after that lobectomy he undergone some chemotherapy and radiation therapy as well. In that case, his left lung lobectomy was performed, followed by a radiation and chemotherapy were initiated for him. So this chemotherapy and radiation therapy happened after the surgery in the hospital. This is the difference between that both. I hope it is clear. If you are not clear, ask me personally, I will explain. Next is about the admission. Patient admitted to hospital and presented. If the patient came to hospital by himself, we can write presented. He presented to the hospital with complaint of. If there is one complaint, you have to write complaint A, complaint of. If there are many complaints like abdominal pain, nausea, vomiting and so on, so you have to mention complaints of. There is no A before that. You have to write admitted to hospital with complaints of. Presented the second time. If you want to write multiple visit, you have to write presented, represented on his subsequent visits, like that. Or if he is admitted after 2 weeks or in this date, you are writing like that. So presented, many are making mistake, like first initially he was presented with so and so, then second time he represented with, then third, fourth or fifth on his subsequent visits. You can use like that. Another question was about adding comma. I cannot tell you that where all areas you can put comma, but as you all know, dear sir or madam, you have to put comma. Dear Mr. So and so, you have to put comma. Then when you write age of the patient, in reference, REF, then you are writing the full name of the patient. Peter Cat, his age is 62. If you are going to write aged 62, in between you can put a comma. Peter Cat, comma, aged 62. And if you want to write age 62 years, don't write there. Better to use the second line, age 62 years. Peter Cat in one line and age 62 years in the next line. And there is another way. It's not always practical, but you can try this. If you are talking to a person and when you want to give a pause, there you can put a comma. For example, please do not hesitate to contact me. There is a pause. If you have any further queries, and contact me. After contact me, you can put a comma there. If you want to tell something with a pause, please do not hesitate to contact me if you have any further queries. On examination, there is a pause. You can put comma. This is the way we are using commas in OET letter. And about capital letter usage. Whatever name you are going to tell, Mr. Peter, Miss Belly, whatever, you are going to tell a patient's name. That time you have to use capital letter as the beginning. We all know, if I want to tell something, I should be in capital. Medication name. All the medication brand names must be in capital letter. But if you are not sure about the medication, is it brand name or is it a generic name, you can copy from the question itself. Sorry, question they will give as the capital form for some letters, like some medication, you can copy from there as it is. Then another is about the position. If you get community health nurse, you have to use C capital for community, H capital, N capital. This is the position. Doctor, you have to use D as a capital. I think that's all thing you need to remember. And some diseases, like some diseases we know, for example, a surgery, David's procedure, which was named in the person name David, so D must be capital. Then Bell's palsy, B capital. Or Parkinson's disease, P capital. Something like that. I don't remember all these things, but if any disease comes with somebody's name, you have to use that in capital letter. I hope that's all in the capitalization. If you have any further doubt also about that, you can comment. I will clarify that. And has undergone. As you all know, we will not use any has or have before underwent. Underwent is something which already completed in the past. That means his surgery was done in 2000. That means that action finished there. It is in the past. In that case, we can use underwent. But we can give as an example, Mr. X underwent total knee replacement surgery. So it is not mandatory to have a date or date there. But if you use like a 12/12/2020, it's fine. There is no problem to add a date on that. Or you can start with on this date, Mr. X underwent a surgery. Either way you can use it, which is correct. The only thing you have to remember is underwent in the sense that action is already completed. Next is about has undergone. Has undergone. You know, has we are going to use something related to the present. Has undergone in the sense you are still in that time period. In the morning, this short period, in morning, he has undergone a surgery, total replacement surgery. So it's not yet finished. You are still in the morning period. It's not yet finished. That time, this short time period, that surgery may be just now finished or a few minutes ago, or still going to complete the procedure related to that. In the period you can tell. This week you can tell has undergone this week, which is completed, but we are still in this week. It's not, we are not telling about the long story. Underwent we can use if you get ago in the letter question paper, or if you get long history, many years ago, that history, you can use underwent. Has undergone this morning, this week, this month. If they mention that you are still in this time period, in that particular time period you are still there, that time you can use has undergone. If you are not clear about that, comment, I will clarify that out also. Then in overall, I think I covered almost every questions. I would like to mention some more things. Like when you write age, uh, somebody is writing like 40-year-old man. If you want to write 40-year-old man, 40 hyphen year hyphen old man, comma. Before 40, a 40-year-old man. If you want to write 40 years old, don't put hyphen in between. 40 years old, full stop, not man, comma, nothing. If you want to write 40-year-old, 40 hyphen year hyphen old man, comma. I think it is clear. Then I forgot to tell about the connectives. According to the new update, we are not supposed to use any connectives in the OET letter. That is highly appreciated. But if you want to use, you can use maximum of 4 connectives. When you want to use a connective, because you have to increase the length of sentence, that time you are searching for a connective. Now my suggestion for you is to avoid the connectives, because as you all know, if you make a big sentence, the chance of mistakes are very high. So use the simple sentence. Before we were writing like Mr. X is being referred to your facility as he requires or follow for continued care and management, followed by recent hip fracture and so on. So we were making big sentences. Nowadays they don't want it. You can make very simple sentence. I'm writing to refer Mr. X for follow-up care and management. Full stop. That's enough. So this way we can make the sentence very simple sentences. So there is no point of adding more connectives in OET letter. You can use simple sentences without connective. I hope that's clear for you all. Then usage of even though, although. If you are using even though, you have to use negative sentence first, then positive sentence. For example, even though Mr. X is in pain, or even though Mr. X has knee pain, he is able to walk through the corridor. That is even though usage. If you use although Mr. X is walking through the corridor, he has knee pain. That is the exactly opposite. Even though and although, that frequent mistake was coming up. Then usage of passive and active form. When you listen to active form, passive form, this will be a bit difficult for us to understand. For easy understanding, I can say we started a paragraph with Mr. So and so, Mr. John. Then the next sentence you write he has hypertension. The third sentence you want to write that he is taking a tab amlodipine for his hypertension. So when a reader go through that, he will feel like Mr. X, he as a subject. Instead of that, you can write Mr. X in the first sentence, he has hypertension, you wrote. Then the third sentence, tab amlodipine was prescribed for him. That is what passive form is. It's very simple if you understand. Active is he has hypertension, so that tab amlodipine prescribed. Passive is tab amlodipine prescribed for him. It's quite easy if you understand this way. And I think that's all were the questions from all of us. Then about the this usage of on we are using for day and a date for shorter period of time, like on admission, on physical examination, on investigation, so and so. In we are using in month, in January, in December, and in year 2000, something like that. At we are using for a time and place at 6 o'clock, or at this he has an appointment uh, on this day at 5 p.m. That's all. Very important thing I would like to mention is about the an and a usage. We all know we are using an is before the vowels, and in the English grammar there are some countable, non-countable words, something like that. I'm not going deep in that. I don't know even much about that. So, for your better understanding, I will say in OET before assessment arrangement X-ray, MRI operation. I repeat, assessment, arrangement, X-ray, MRI operation. We need to use an every time before X-ray and MRI. Don't forget an X-ray and MRI. Then surgery, uh, ongoing care, treatment, pain, information, accommodation, assistance, advice, attention. Surgery, accommodation, assistance, advice, attention, ongoing care, treatment, pain, information. We have to use a. Some of them are starting with the vowel, even though we need to use a before that, not an. These all words, please make a note on that. And when you write in the OET letter, don't use an before this. We have a tendency to use an accommodation. It's wrong, a accommodation. Then admitted to the hospital. When you use the, you should have a hospital name, not just a hospital, you should have a hospital name. When you want to tell body parts or a body system, like the ear, the right leg, right knee, the right hand, they should be there. Any specific designation, like the dietitian, you can write. Any specific complaint, which is one complaint, you can use the. Then for the as I told, an usage, in the age also there are some age you need to use an, which is starting with the vowel letter. 8 e is starting. 8 11 e is starting. Then 8, of course, 18, 80, 80, 81, 82, 83, up to 89, we have to use an before that if you are writing it. Then I hope I have cleared everything now. So far, if you have any concerns, any questions, I know that this grammar session is a bit difficult for everyone. So if you have any further question, you can comment that. I'll try to answer it. And if you find any mistake in my video, please comment that too. I'm ready to accept my mistake and I will clarify that. I don't want to share mistake to any people. So I'm repeating that this is a grammar session, so I can make mistake in that. If there is anything, please notify me.